everyone. Thanks again for your patience. We are going to get the webinar started in just a moment. In the meantime, I want to thank you all for joining us today and ask you to help us out with an audio visual check. If you can hear me clearly and if you can see my screen, which is the first slide of a PowerPoint presentation, I'd appreciate it if you'd go ahead and send me a message in that questions section of your GoToWebinar control panel. And I'm also going to ask our guest panelist, Ram, to give us a shout out and say hello to make sure we can hear him as well. Thanks, everybody.
Hi there.
Fantastic. It looks like we can hear our panelists clearly, and from the feedback from our audience, you can see my screen and hear me clearly as well. So let's go ahead and jump right into it. So thank you again, everyone, for taking the time to join our special topic webinar, NeedyMeds Storylines, the free app to track your health. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And before we get started, I just want to go over a few points. You can type any questions you may have into the questions section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. One quick disclaimer, our guest Ram, who I will introduce momentarily, is not a health expert. He is an expert in the NeedyMeds Storylines app. Anyway, if we do not have the time to answer your question, we will follow up with you via email. I will provide the contact information at the end of the presentation, and this webinar is being recorded and will be available on our YouTube channel. You can find a copy of the PowerPoint slide decks in the handout section of your control panel as well. So let's get started with what is NeedyMeds. What you are looking at is our mission statement, our vision statement, and how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do this free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. I always like to put up a screenshot of our homepage because really our website is the face of our organization, and it gives me a chance to point out a few resources. If you are interested in healthcare cost savings resources, check out that Patient Savings tab on the top left of the navigation bar. To stay up to date on what's new at NeedyMeds, check out the Advocates tab. This is where you can sign up to receive webinar announcements, sign up for a monthly newsletter, and order educational materials. I mentioned this webinar is being recorded, and you will be able to find it on our YouTube channel, which is at the top right-hand side of our homepage with the rest of the other social media icons. And you can check out other upcoming webinars and register for them on the calendar of events on the bottom right-hand of our homepage. Anyway, as you saw, a big part of our mission is empowering people when it comes to their health. And one of the most popular ways we do that is with the free NeedyMeds Storylines app. NeedyMeds Storylines is a self-care app that helps you to take control of your health. It can act as your medication reminder, symptom and vitals tracker, pain rating scale, and so much more. With this presentation, you will learn all about this app, including the features it has and how it can benefit you. And walking us through all this will be the NeedyMeds Storylines app expert, Ram Soyal. Ram graduated from Sheridan College with a Bachelor's of Film and Television. Ram continues to pursue his passion for humanizing down-to-earth storytelling within the lives of everyday people and their personal journeys. Ram uses his education, experience, and insights to develop technological solutions that empower patients. So without further ado, I'm going to go ahead and pass the mic and the screen to Ram, so bear with us while we do that. And as Ram takes over the mic and the screen, I will remind everybody that if you do have questions, you can go ahead and type them into that questions section of your control panel. And with that, I'll pass it to Ram. Enjoy, everyone.
Hi, everyone. Thank you, Carla, for the wonderful introduction, and thank you, everyone, for joining our webinar today. My name is Ram, and I'm a product and marketing specialist here at Self-Care Catalysts. Self-Care Catalysts is a patient analytics company that focuses on digital therapeutics and alternative methods of care, as we strongly believe that patients should always come first. Now, in collaboration with NeedyMeds, we've created a free self-care app that makes it easier for users to track, manage, and assess their health conditions. It also carries a digital version of the NeedyMeds discount card, as well as other health-related information and resources on assistance programs. So you can access your health tools and discount card from your mobile device at any time. If you currently don't have the app on your phone, you can easily download it for free on the Apple App Store or the Google Play Store. So I prepared a presentation here today, and this is a small agenda of what we'll be discussing. I will be talking about our company, Self-Care Catalyst, what we do and what we believe in. And then I will be demoing the NeedyMeds Storylines app for you today, again, which is completely free. And at the end, there will be time for questions. So Self-Care Catalysts is a patient solutions, intelligence, and analytics company deriving value from patient-centered, real-world evidence to inform personalized care, behavior change intervention, population health, drug discovery, and commercialization. We have three main pillars that we like to believe in here. And the first one being that patients will build and own their health data. Today, patients are starting to amass their own health information, more like a treasury, due to a proliferation of wearable devices and growing interest in understanding who they are, especially when they're sick. We believe that patients will become more active participants in their case. The practice of paternalistic medicine has unfortunately relegated the patients to recipients of care. However, as patients gain access to more health and treatment information, they're being equipped to become real advocates of their own health. And ultimately, we believe that patients will drive the future of health innovation. The creation of patient-generated health behavior information will spell the difference between solutions created inside the clinical setting and those where patients took an active role in designing the intervention. The empowered patient will provide a more holistic platform to deliver true, personalized health care. Your doctor only sees a fraction of what's really going on. How you were feeling the past few days, symptoms that you may remember when you were feeling them, meals that you had, moods that you experienced, thoughts, and your daily life routines. Now, what Health Storylines does is captures everything that happens in between. And it's your job to fill in the rest of the story. NeedyMeds Storylines is created by a passionate team of self-care advocates who believe that the key to healthcare innovation is to hear the voice of the patient. We are collaborative. Even though we are experts, we believe that none of us is as smart as all of us. We are passionate. Our passion drives us to prove to the world that hard things can be done. And we are connectors. We incite our users to empower themselves, to improve their lives by integrating the app into their lives. It's why we love sharing what we know. We believe that the greatest source of innovation in healthcare could be you. So as I mentioned, we do have three pillars within Health Storylines, and it's based around the do, learn, and share method. So by doing and breaking down care plans and interventions into smaller, simple, personalized tools, we believe that patients and caregivers are often handed a complex list of care plans once they leave the clinical and hospital settings. But without medical guidance and support, adherence to interventions, treatments, follow-up diagnostics, and monitoring becomes difficult for patients and caregivers. Health Storylines enables patients and caregivers to personalize and customize a plan through health behavior tools that become healthy habits. Learning, because informed patients make better decisions. As patients and caregivers use a range of tools, for example, our journals, appointment calendars, symptom trackers, and mood trackers, they learn more about themselves and how their illness impacts their lives. Health Storylines enables patients and caregivers to learn, understand, and gain insights about their own health conditions. And finally, sharing, because shared knowledge powers better care and outcomes. Patients and caregivers are empowered to share their health data with their physicians, peers, caregivers, and researchers to inform decisions that will improve care and outcomes. NeedyMeds Storylines enables patients to build their own communities to learn from each other. It enables patients and caregivers to personalize and customize the plans through health behavior tools that eventually become healthy habits. So that's it for my little presentation. I will be demoing our app to you just on the side here. Okay. So this is the home screen of NeedyMeds Storylines. This is what you'll find after signing up, after you download it from the App Store or the Google Play Store. I'm going to walk you through the home screen, explaining some of the things that you might see or interact with on a daily basis, some of the main tools that you will find right after downloading, and some other features that will help you track and manage your health. First of all, there's the daily health check-ins right on the top here with a number 2 on the right. This is basically a summary of everything that you need to track within the day. It can form as a reminder, and it can be a little helper in case you forget before you go to bed, the medications that you have to track, the moods that you experience that day, the symptoms that you experience. So basically this just provides as a summary of the things that you need to think of in terms of your health. Our first tool, and I would say our most used tool, is a medication tracker. Here you can create your own reminders and add medications freely. So here we can add Adderall, and I can create my own reminders for them as well. So I can create a daily reminder 1 time a day at 9 a.m. And we click next on the top right here. And as well, we can add any extra notes that we need to remind ourselves for. Don't forget to click finish on the right-hand side here. And we can confirm with the prompt screen. And there you go. We've actually successfully added our first medication. And if we go to the home screen, there it is, Adderall. And I can select whether I've missed it or taken it. So today I've taken it. And there we go. We've tracked our first piece of information within our app. You could also add multiple medications as well. If you go to add and edit, you can add another medication like lisinopril. And we can create another daily reminder, but this time, let's make it in the evening. Press next here, any extra notes for ourselves, and we can select finish. Once again, that will be on your home screen for you to track at 9 p.m. And if you end up missing it, there are some prompts that we forgot or anything else that happened within your day. The second tool I'll be talking about today is the Daily Moods Tracker. The second one right here. This is a tool that that helps me track how I've been feeling today. So have I been sad? Have I been neutral? I've been happy. Today, I can track that I have been happy. And I can also add any additional notes just for myself. So far, we've used the medication tracker, and the daily moods tracker. Another useful tool that you can use is a symptom tracker. You can track any symptoms that you've been experiencing. And again, you could willingly add or customize any symptoms that you'd like to track. So today, I'd like to track headaches. Again, I can add any additional notes and select finish when I'm done. Now on the home screen, when we click symptom tracker again, here we can track my headache and the impact the symptom that it had on my day. So today it wasn't too bad. It was a 3 as I used a slider. And just like that, I've tracked my headache symptom. So you may be asking, where does all this data go? I've tracked all my information. Where can I see it? On the bottom left, right beside the home icon, is a graph icon. And this is what we call the My Storylines feature. Here, you can see all of your track data, as in that I've taken my medications, that I've tracked my moods over the past week and how I've been doing, how my symptoms have evolved over the past week in terms of severity, as well as any other tools that I choose to use. You can also export your data using this button in the top right. And this is called the My Storylines report. So you can export your data into CSV or PDF format in increments of 1 month, 3 months, 6 months, or all time. And we will email that information to you, and you can use that to bring to your doctor, to show your caretaker, or anybody in your care circle. So another feature that we do have is the tool library. Here we can freely add tools to our home screen. So we do have the medication tracker and the symptom tracker already, but maybe I'd like to track my diet. If I scroll down for the food nutrition and click diet log, I can freely add that tool and it will be on my home screen. I could also remove this tool using this remove button, remove tools button, and selecting the X and delete it from my home screen. Another feature that I'd love to point out is on the top left is a person icon. And if you click that, you can go into your profile. Here, you could access your own personal details, your email, your first name, your last name, your personal health goals, whether you'd like to receive emails from us. And you could also update your condition. So, if I say that I experienced ADHD, and I've been diagnosed in the year 2012, and I finish by updating my profile here on the bottom, I can go back to my home screen and see that 2 new tools have been added automatically to my home screen, which is the Task Challenger and the Health Routine Builder, which is specific to ADHD users. So for example, this Health Routine Builder, I can create my own healthy habits, like going to the gym. I can select the frequency of the reminders and when I'd like to be reminded, much like the medication tracker. I could also put in any extra notes. and have that reminded for me going forward, which I've done. Some other features that I also like to point out is syncing a device. Here, you can sync any device, any wearable that you'd like, from Fitbits to scales. And that data, after syncing, will be populated within your My Storyline section here. And that is the general overview of our NeedyMeds Storylines app. Carla?
Fantastic, Ram. Thank you so much for the thorough and easy to understand presentation. It was a great demonstration because it shows not only how much the app can do, but how simple it is really to use. And this is a moment that I will remind everyone, and I just want to make sure everybody can see my screen. And I want to remind our audience that if you have any questions, I see some coming in. You can send them in by typing them into that questions section of your control panel. And as they come in, I do want to remind everybody that NeedyMeds is here to help additionally to support you with your healthcare expenses. On your screen are our most popular and cost-effective healthcare cost savings resources that we do hope you check out. You can find all of those under that patient savings tab that I pointed out in the beginning of today's presentation. And of course, to learn more, you can sign up for one of our upcoming monthly overview webinars. And you can find those on the calendar of events on the bottom right hand of the NeedyMeds homepage, which again I pointed out at the beginning of the webinar. So as we get to those questions coming up, I want to leave up the contact information in case you have any questions about the app or if you would like to reach out to NeedyMeds. So Ram, one of the questions coming in here is, can I share my tracked information with other people? It's a great question.
Absolutely. So you can share your tracked information with other people. There is a feature on NeedyMeds Storylines called Circle of Support, where you can add other users that are using the same application, like your friends, your family, your doctors, your caregivers, your caretakers. And once you add them, they can see the information that you've tracked. And the catch here is that you can actually customize what they can see. So if it was your family, you could let them see your moods and your symptoms. But if it was your doctors, you can let them see the medications that you're taking or some of the symptoms that you've been experiencing as well. So there is that customizability and flexibility with that.
Thank you so much. And I like that you can pick and choose who you want to share what information with. I think that's really crucial. Another great question coming in is there an option to take all of my track data and share it with my doctor?
Yes, I think that was one of the features that I touched briefly upon, which is the My Storylines report. All of the information that you've been tracking can be exported into a report, a PDF or a CSV, and we can email that report to you. So you can either print that out or you could show that to your doctor on your phone. So it's very mobile in that way.
The fact that it's very mobile, I think, makes it even more useful. Here's another great question, and I bet you get this question a lot, Ram, which is, what happens to my data after I track it? Who can see it?
Absolutely, that is a wonderful question, especially in these times where data is so free right now. So basically nobody can see your data other than the people or the data researchers that work within Self-Care Catalysts. Your data that you track is also de-identified and anonymized. So when I say that, we can't see your name that's associated with the information that you tracked. So we can't associate this information back to you in any way.
That's Very helpful. And again, I'm sure you get that all the time. And I'm really happy that our audience has asked these great questions, because I always feel that if it's something an audience member is thinking of, probably somebody else that's listening in is thinking of as well. We do try to keep the question segment brief. So if you asked a question and we didn't get the chance to answer, we will follow up with you. Or, of course, you can direct any questions you have about the app to the contact information on the screen. And don't hesitate to contact NeedyMeds if you are seeking assistance with your healthcare expenses. With that, I want to thank you all again for taking the time to join us, and thank you to Ram for taking time to share his expertise with the NeedyMeds Storylines app with the NeedyMeds audience. Thanks, everyone, and have a great rest of the day.